as you, when I'm going to train you today in just a small version of it, but if you understand the biochemistry, I'm going to present it very differently than what you've had in terms of any bioidentical hormone replacement therapy training. One of the first things when I asked myself in pursuing medicine, anti-aging medicine, I said, why HRT and why anti-aging medicine and why is it safe? By the time I finish, you're going to feel so secure about prescribing and you'll get the gist of it. But the idea is synergy and using nutrigenomics to enhance your bioidentical hormone replacement therapy regimen. So we went and learned all the nutrients as drugs, as pharmaceutical agents. And there is pharmacology of vitamin C, pharmacology of tocopherol. So you learn, and once you learn how they act at the genetic level, you have then, you've surpassed even your training. So the very basics, why HRT and anti-aging medicine? I want to give you a little history of how, what happened to synthetic hormone replacement therapy. E1 is converted reversibly from estradiol in the liver and small intestine. But after menopause, the adrenals also become an important source of producing the estrogens. So the body needs to be able to learn how to deal with estrogens. Once you get to prescribe this and learn the biochemistry, that bioidentical hormone replacement therapies lowers the inflammatory markers, and there's plenty of now evidence base for that, cytokinins, interleukin-6. Let me tell you the safest way to titrate up, okay? You don't have to, based on the results that you see, immediately have to jump to a particular dose. Why don't I give you a starting point, and then I'll tell you what are some of the pearls of like how you can get people to balance with the minimum. You start your patients this way, you will never go wrong, and then once you get them on a beautiful regimen, then you can mix them all in and say, okay, a pharmacy, do this for her or him, okay? Go low, please, initially, because then you can go to like 0.5, and then you can go to like 0.25, and add the 0.5 milligrams of estriol per mil, and then just say half an applicator. And if that's not enough, she just titrates upward. This is the Adams questionnaire generally. So I'm just going to show you how you can kind of protect yourself when you're prescribing testosterone for males, okay? I would do the Adams questionnaire. The HCG is a marker for cancer. So you don't want to be building the smaller, everything is smaller peaks.